million people a year are the victims of hospital-acquired infections in this country, and I believe it will take some legislative interaction to have significant improvement there.
Thank you for joining this episode of the Elephant in Your Hospital podcast with Futura Healthcare. I'm Jeff Steinman, Regional Director at Futura, and today I'm joined with industry healthcare leaders from SealShield, Al Messer and Brad Whitchurch. In today's podcast, we're going to discuss the rise of hospital-acquired infections. Brad and Al, if you don't mind, if you could give a brief intro of yourselves. Brad, we'll start with you.
Thanks, Jeff. My name is Brad Whitchurch. I'm the founder and CEO at SealShield. We're an infection prevention company. We've been around since 2006. Our mission is to prevent infections and save lives through technology and data management. We're best known for our washable, submersible keyboards and mice, as well as our antimicrobial UV-resistant screen protectors and UV device disinfection system, the Electroclave.
Excellent. And Al?
Thanks, Jeff. Happy to be here. I'm the Northeast Territory Manager for the SealShield. Been with the company for a little bit over 6 years. I've been working within the healthcare space for over 25. And my role with the company is to work with hospital systems, addressing their challenges when it comes to infections and addressing those point of contacts, and as well as working with reseller partners like yourself and addressing those needs.
Excellent. Thank you both for the introductions. Brad, for the folks listening, could you share some of SealShield's areas of expertise and the changes you've seen since the uptick in hospital-acquired infections since the pandemic?
Absolutely. So, our areas of expertise really surround some of our technical capabilities and expertise in waterproofing of electronics and antimicrobial polymers. In 2007, SealShield introduced the world's first dishwasher-safe keyboard and mouse. And at that time, we were really evangelizing that solution. And today, we see it as really more of a standard, certainly in U.S. acute care. And we manufacture those products in 30 different languages and distribute them worldwide. That product has been extremely successful, and we've taken the profits from that division and reinvested them in other emerging technologies to help reduce hospital-acquired infections. And today we're the leading developer of UVC solutions for device disinfection and surrounding technologies.
Very good. So during the early days of COVID, hospital-acquired infections seemed to have dramatic increases, and this was probably attributed to the number of hospitalizations on the uptick there. This resulted in many patient safety metrics deteriorating. Are there some challenges, the same challenges true today, post-pandemic, or what's causing what we see to be more increases in HAIs out there?
I think there's a lot of factors leading to the increase in hospital-acquired infections, HAIs. After decades of progress, we saw that during the COVID pandemic, we began to get an uptick in the HAIs being reported. 2021 CDC report showed a significant uptick, particularly in MRSA, and more recently, the Leapfrog Group has come out with their annual hospital rating system, and that was the headline that hospital-acquired infections are on the rise. And among the largest is MRSA, which has been called the superbug. It's an antibiotic-resistant bacterial infection, and we're seeing significant increases post-COVID. And I think the reasons are many faceted, and you touched on a few of them. Staff shortages have been become a bigger issue as a result of COVID. And when you have an emergency such as the COVID pandemic, it becomes a priority. And some of the best practices fall off the table. And we've just got to get back to best practices and cleaning protocols. And we're all ready to make epidemiology boring again. Sadly, I think the challenges are persisting post-COVID.
So even pre-COVID, Brad and Al, hospital-acquired infections have always been a huge challenge for everyone. What are the differences now post-pandemic? Has the hospitals taken on more of a proactive approach as opposed to a reactive approach? And what what can the nursing staff, the clinical staff, as well as the patients and their family members entering the hospital, what can they be doing to be aware and prevent the spread of infections?
I mean, I'll answer this. I think what I've seen with some of my customer base is a better awareness from what happened during the pandemic. I think a lot of different departments within the organization are starting to have that engagement, whether it's between the IT department, nursing informatics. I think what the pandemic has caused is a need and a need to get these different departments on the same plan and address some of these risk factors and trying to even be preventative. You kind of had a two-part question there, and what we
Sure.
can do as patients when we're going to some of these facilities and receiving care. I think for the most part, is just be draw attention or have attention, be aware of your surroundings, the common touch areas. Is the staff, is your healthcare provider, touching a mobile device, without washing it? Are they coming in contact with your loved ones? So, something with those types of surfaces, how they being addressed is something that you can advocate for yourself when you are administering care or you're there with a loved one.
You bring up
I would,
a real good point there, Al, because oftentimes in hospitals, different departments are siloed, and with EMRs being pushed out and technology being integral in any patient care interaction, it's hard to avoid, not paying attention to the technology, not wiping down the keyboards, not cleaning off the equipment in between patient touches. Brad, what's the message from Seal Shield in regards to that? To come off of Al's message there.
well, yeah, I would add to what Al said that, hand hygiene continues to be a focus, and there is new emerging technology that can help to drive hand hygiene compliance. But related to the points that Al made, we now know the studies are out that show a one-to-one correlation between the hands and the devices that the hands touch. So if you're investing money in your hand hygiene compliance, but you're not investing in device disinfection, there's a one-to-one correlation. A clean hand that touches a dirty device becomes a dirty hand. So it's really a multifaceted approach that healthcare facilities need to be taking to address the multiple vectors of cross-contamination infection that help drive superior hand hygiene compliance outcomes. And in terms of what we can do as patient advocates, I think during COVID there was some transient funding, and now many healthcare systems are struggling. And as patient advocates, we can reach out to our legislators and really put pressure on them to provide better standards and greater funding to combat hospital-acquired infections. Jeff, not a lot of people realize it, but 2 million people a year are the victims of hospital-acquired infections in this country. And I believe it will take some legislative interaction to have significant improvement there. As patients, we can protect ourselves. We mentioned the leapfrog rating system, and you're actually 90% more likely to die in a leapfrog rated D or F facility versus an A facility. So as patients, we can educate ourselves on where we're receiving our health care, and that puts pressure on facilities to improve their outcomes, to be reflected in their rating scores, so that people demand their services.
Speaking of improvements of outcomes at hospitals, do you have any specific examples or clients that you have worked with who have implemented programs that have had a positive effect in reducing HAIs?
I can speak to this. I know with my customer base, I've seen a big focus on addressing the mobile devices, handheld devices within clinical areas. I think the old policy or requirement of having staff hopefully wipe down their devices at certain intervals is becoming archaic now, and seeing that a lot of the infection preventionists out there are realizing the challenges of managing that and having oversight. So we have seen an increase of a need of implementing or deploying some UV technology that can address, a full disinfection of that device instead of relying on cleaning, because we all know that cleaning and disinfecting are not the same. They don't cancel each other out. And even if you had the clinical staff that's fully trained and they are wiping down their devices, you still need the dwell time or contact time for that to take effect. And from a workflow standpoint, asking these clinicians and the work that they're trying to do, the care that you're trying to administer, to leave that device sit idle for 3-5 minutes before they engage with it is very hard to ask. So, still, want to promote wiping down, but using that UV technology to get that full disinfection is something that we've seen more hospitals implement.
So in speaking today, it does sound like, to a large degree, education is a big part of this. We can supply the tools, we can supply the knowledge, but the folks involved, utilizing the equipment, administering patient care, even the patients themselves have to take on some of the workload to make sure they're doing all they can to stem the spread of infections. So thank you for listening to today's episode. Be sure to subscribe to listen to future episodes of the Elephant in Your Hospital podcast. Thank you, Al. Thank you, Brad.
Thank you, Jeff.
Thank you, Jeff.